This video is about overall view of lower limb. Now let's see the three main joints present in the lower limb: hip joint, knee joint, and ankle joint. Between hip and knee joint is thigh. Between knee and ankle joint is leg, and below ankle is foot. So this is the outline of lower limb. Below the inguinal ligament is thigh, then we have knee joint, leg, ankle joint and foot. So in thigh, what are the compartments? Anterior, medial and posterior. Now coming to the front of thigh, we have two important topics. One is femoral triangle. We should also know about femoral sheath, femoral canal and femoral ring. In the medial compartment of thigh, there is a canal called as adductor canal, otherwise called subsartorial canal or Hunter's canal. We should know the boundaries and contents of this adductor canal. Now coming to front of thigh, what are the muscles present in the front of thigh? So it is sartorius. Number one is sartorius. Then we have quadriceps femoris. These are the only two muscles present in the front of thigh. So when we say quadriceps femoris, it contains four muscles. Those four muscles are three vasti, that is vastus medialis, vastus intermedius and vastus lateralis, plus one more muscle, that is rectus femoris. And we have a small muscle just below vastus intermedius in the anterior compartment of thigh, which is called articularis genu. So just above the knee joint we have articularis genu. All these muscles in the front of thigh are supplied by femoral nerve, because femoral nerve is the nerve of front of thigh. Root value is dorsal division of L2, L3, L4. This femoral nerve is divided into anterior and posterior division. So this anterior division supplies only one muscle in front of thigh, that is sartorius. The muscular branch of anterior division is sartorius. What is the cutaneous branch? This anterior division has two cutaneous branch, medial cutaneous nerve of thigh, intermediate cutaneous nerve of thigh. Lateral is a direct branch from lumbar plexus. So this posterior division supplies rest of the muscle, that is quadriceps femoris. And there is a cutaneous branch called saphenous nerve. This is all about femoral nerve. Now femoral artery. We should just know femoral artery is a continuation of external iliac artery. It continues as popliteal artery. It has 6 branches in femoral triangle, 3 superficial deep, 3 superficial or circumflex iliac, epigastric, external pudendal, 3 deep or deep external pudendal, profunda femoris and muscular branch. There is one more branch called descending genicular branch, which participates in knee joint anastomosis. So this is all about front of thigh. So we have femoral triangle and adductor canal in the medial compartment. We have seen all the muscles, nerves, arteries of front of thigh. Next compartment in thigh is medial compartment. In this medial compartment, this is adductor canal. Boundaries of adductor canal. The roof of the adductor canal is formed by sartorius, anterolaterally by vastus medialis, posteromedially by adductor longus and adductor magnus. So this is the boundary of Hunter's canal. Now what is the content of this adductor canal? So the contents of femoral artery, femoral vein, saphenous branch of femoral nerve. We have just seen saphenous branch is a posterior division of femoral nerve. Then both anterior and posterior division of obturator nerve. These are the contents of adductor canal. Now what are the muscles present in the medial compartment of thigh? For that we should know also about the muscle which forms the floor of femoral triangle. So lateral boundary is sartorius, medial boundary is adductor longus, base is inguinal ligament. From lateral to medial we have iliacus, psoas major and pectineus. So this pectineus, this is also present in the anterior compartment and the medial compartment. So it is supplied both by femoral nerve and obturator nerve. Hence pectineus is a composite or hybrid muscle. What other muscles are present in the medial compartment? They are, along with pectineus, adductor longus, adductor brevis, adductor magnus, and one of the gyro muscle, gracilis. So what are the muscles present in the medial compartment of thigh? First pectineus, adductor longus, adductor brevis, adductor magnus, gracilis. The pectineus receives two nerves, femoral and obturator. Adductor magnus receives two nerves, obturator and sciatic. And gracilis is a part of gyro. What are three gyro muscles? Sartorius, gracilis and semitendinosus. Now all the muscles in the medial compartment is supplied by obturator nerve. Obturator nerve is the nerve of medial compartment of thigh. Root value is ventral division L2, L3, L4. So here we have subsartorial canal we have just seen. The roof is formed by sartorius, antero-laterally vastus medialis, posterior-medially adductor longus and magnus. And we have few contents, femoral artery, femoral nerve, saphenous branch of femoral nerve, and anterior and posterior division of obturator nerve. Now moving on to the posterior compartment of thigh, that is back of thigh. So what are the muscles present in the back of thigh? Semimembranosus, semitendinosus, adductor magnus and biceps femoris. Now there is a group of muscle called hamstrings. What are hamstring muscle? Semimembranosus, semitendinosus, ischial part adductor magnus, long head of biceps femoris. So this hamstring muscles are supplied by, so what is the nerve of back of thigh? It is sciatic nerve. We have two components. Tibial component supplies hamstring muscle. The common peroneal component supplies non-hamstring part. So what is the non-hamstring part here? It is short head of biceps femoris. The adductor magnus ischial part is hamstring, whereas non-ischial part, it comes in the medial compartment, so it is supplied by obturator nerve. So adductor magnus is a hybrid muscle. But biceps femoris is not a hybrid, it is supplied by tibial and common peroneal component of a same nerve, that is sciatic nerve. Now moving on to popliteal fossa, it is a diamond-shaped fossa. We have four boundaries, superomedially semitendinosus, semimembranosus, superolaterally biceps femoris, inferomedially medial head of gastrocnemius, inferolaterally lateral head of gastrocnemius. What are the contents of popliteal fossa? Popliteal artery, popliteal vein, division of sciatic nerve. Near biceps femoris is common peroneal. The tibial nerve just enters the posterior compartment of leg. So these are the two divisions of sciatic nerve in popliteal fossa. So we are done with popliteal fossa. Now moving on to leg. We have three compartments: anterior, posterior and lateral. So let's move on to anterior compartment of leg. This is extensor retinaculum. Extensor retinaculum is of two, superior and inferior. Inferior extensor retinaculum is in the shape of Y, which has a stem, upper and lower limb. What are the structure which passes beneath this extensor retinaculum? We have muscles, nerves and arteries in front of leg. So from medial to lateral, so these are the arteries and nerves, and the one which are drawn in pencil are the muscles. Okay, now from medial to lateral, just beneath the extensor retinaculum, it is tibialis anterior, extensor hallucis longus, then comes anterior tibial artery, deep peroneal nerve, extensor digitorum longus, peroneus tertius. All the anterior compartment muscles are supplied by deep peroneal nerve. So all the muscle causes dorsiflexion of ankle joint. When there is fracture at the neck of fibula, this deep peroneal nerve, the common peroneal nerve gets injured, where the dorsiflexion is not possible, which results in foot drop. So what is the artery here? Anterior tibial artery. This anterior tibial artery, when it reaches the foot, dorsum of the foot, it becomes dorsalis pedis artery. So we should know dorsalis pedis artery is a continuation of anterior tibial artery. Now moving on to the lateral compartment of leg, we just have two muscles, peroneus longus and peroneus brevis. What is the nerve of lateral compartment of leg? Is superficial peroneal nerve. What is the action of these two muscles? It causes eversion of subtalar joint. Now moving on to posterior compartment of leg. From medial to lateral we have tibialis posterior, flexor digitorum longus, posterior tibial artery, tibial nerve, flexor hallucis longus. Now all the muscles are supplied by tibial nerve. They form plantar flexion at ankle joint. So dorsiflexion is formed by anterior compartment muscles, plantar flexion by posterior compartment muscles. This tibialis anterior and tibialis posterior causes inversion, whereas eversion is caused by peroneus longus and brevis. We should know both inversion and eversion takes place at subtalar joint, whereas dorsiflexion and plantar flexion takes place at ankle joint. Now what is the venous system of lower limb? We have superficial and deep veins. So on the dorsum of foot we have something called dorsal venous arch. All the digital veins drains into the dorsal venous arch. Medially, this long vein is called great saphenous vein, which drains into the femoral vein. And this great saphenous vein has perforators, above ankle 3 perforator, below knee 1 perforator, above knee 1 perforator. And this is saphenofemoral junction, where the saphenous vein drains into femoral vein. Laterally, we have short saphenous vein. This drains into the popliteal vein. So what is formation of great saphenous vein? Medial marginal vein joins with medial end of dorsal venous arch to form great saphenous vein. Short saphenous vein, lateral marginal vein joins with lateral end of dorsal venous arch to form short saphenous vein, which drains into popliteal vein. Great saphenous drains into femoral vein, and this popliteal drains into femoral vein. Femoral drains into external iliac vein, which drains into inferior vena cava, which drains into right atrium of the heart. There is a nerve which accompanies great saphenous vein called saphenous nerve, posterior division of femoral nerve branch. Sural nerve accompanies short saphenous vein. Sural nerve is a branch of tibial nerve. Now coming to the arterial system, abdominal aorta is divided into two common iliac arteries. Common iliac further divides into external iliac artery and internal iliac artery. External iliac below inguinal ligament, it is called femoral artery. It continues as popliteal artery, divides into anterior tibial and posterior tibial artery. Anterior tibial artery comes to anterior compartment of leg, posterior tibial artery to the posterior compartment of leg. We have one more compartment called lateral compartment. Here it is peroneal artery, which is a branch of posterior tibial artery. The anterior tibial artery, when it reaches the dorsum of foot, it becomes dorsalis pedis artery. Posterior tibial artery, when it reaches the sole of foot, it is divided into medial plantar artery and lateral plantar artery. This lateral plantar artery joins with the dorsalis pedis artery to complete the lateral plantar arch. So this is all about the lower limb: venous system, arterial system, muscular and nervous system. Thank you.